Hi, everyone, and welcome to our academic discussion. Before we begin, let's quickly introduce ourselves. I'm Daniele, and I'll be moderating today's conversation. I found this week material on pandemics really insightful, especially the global risk and how interconnected our health systems are.
Hello, I'm Michel. I've always been interested in how data and technology can help us respond to health emergencies, so I'm looking forward to this discussion.
Hello, I'm Joe. I've been following how misinformation spreads during pandemics, and I think is one of the biggest challenges we faces today.
Hello, Joe, and hello, Michelle. Great, thanks. Let's dive into our first question. How do we increase more participation in healthcare security? Michelle, would you like to start us off?
Sure. I think one way is through international cooperation. The CDC is already working across 6 continents to improve these detection systems. That's a huge effort, but it needs more support from governments and local health agencies.
Yeah, I agree. And with over 500 million people traveling internationally every year, disease can spread quickly. That's why global participation is essential. Countries must follow the WHO's international health regulation to ensure coordinated response.
Exactly. And we've seen success stories. Uganda and Vietnam have managed to control outbreaks like Ebola and SARS through early detection and cooperation. So let's move to the next question. How do we stop media frenzy and misinformation? Joe, what's your take on this?
So media frenzy often comes from fear and confusion. During the Black Death, the sheer number of that fueled panic. Today, social media can amplify misinformation even faster, and we need clear science-based communication from trusted source.
You're right.
And if I may add something, transparency is key. If people feel informed, they are less likely to panic. So governments and health organizations should provide regular updates and educate the public on how to verify information.
Good points. Media literacy should be a part of public education. So let's move on. What do we do about worldwide poverty and its relationship to pandemics? Joe, would you like to lead this one?
Yeah, sure. Poverty limit access to healthcare and sanitation, making communities more vulnerable. And in 2013, 35 million people were living with HIV, and 3.2 million of them were children, mostly in sub-Saharan Africa. That's heartbreaking and they show how poverty and pandemics are deeply connected.
Yeah, and most of those infections happen during childbirth or breastfeeding. So we need to invest in material health and education. Also, low and middle income countries carry the highest burden. So global funding and support are essential.
Absolutely. Addressing poverty is not just a moral issue, it's a public health priority. So let's move to the fourth question. What do we do about sanitation and its relationship to pandemics? Michelle, what are your thoughts about this?
Well, sanitation is fundamental. In China, 35% of the population lacks proper sanitation. That's a major risk factor. So, improving sanitation can prevent outbreaks of diseases like cholera, E. coli, and even influenza.
And it's not just about infrastructure, public awareness and hygiene education are just as important. Simple habits like hand washing and clean water access can save lives.
Right. Sanitation is a basic but powerful tool in pandemic prevention. So, the final question. Is there something we can do personally with respect to this issue? Michelle, what's one thing you think individuals can do?
Well, we can stay informed and follow health guidelines. Even small actions like getting vaccinated, sharing accurate information can make a difference. For example, during the 2014 Ebola epidemic, strict airport controls helped prevent the spread to other countries.
Yeah, and we can support global health efforts, donate to organization, volunteer, and even just raise awareness. Personal responsibility matter, and I've started following who updates and sharing them with friends.
Yeah, I think social media can be a powerful tool for health education if used responsibly. Do you both agree?
Yeah, definitely. It's fast and global. If used wisely, it can help fight misinformation and promote healthy behaviors.
Okay. So, to summarize, we'll all agree that global participation, clear communication, and personal responsibility are key to managing pandemics. Poverty and sanitation are major factors, and education, both formal and through media, can empower people to act. Thank you both for your thoughtful insights. I really appreciate how you supported each other ideas and stay focused on the topic. Thanks.
Thank you very much.
Thanks. Bye.
Bye.